Welcome. It's time for Wellness Central here today. And Wellness Central, where we like to shed light on some of the health topics that affect millions around the world, and especially here in Nigeria, that continues to be a growing concern in our own community. And this today is cancer. Now, with Cancer Awareness Day here, it's time to reflect on how far we've come in the fight against cancer and to focus on the importance of early detection and also community support. Early diagnosis can be life-saving, they say, as it significantly increases the chances of effective treatment. However, challenges remain from limited access to screenings and also diagnostic tools to the lack of support system for those battling these diseases. So, to help us understand more about these critical issues, we're joined by Dr. Adeoluwa Adeniji, a clinical and radiology oncologist. Dr. Adeniji, thank you very much for joining us today.
Yeah, thank you very much.
True. Now, first off, let's start with early detection. Let's start by asking you exactly how people can go about getting, well, good early or finding good early detection signs.
Okay, good morning, everyone. For early detection, which is the life-saving things that everybody should pursue, everybody should go for. Early detection simply means the cancer is detected very early when it is still small, when the survival rate is almost at least 95% and above. So that's what early detection is. And that can be done in different ways. For example, to talk about breast cancer early detection, we're talking about a case where an individual would have been able to go through the screening, processes, and the breast cancer would have been detected very early, maybe through mammogram, through breast ultrasound scan, and also through examination that is done at home or the one that is done in the hospital. And there are other types of cancer, for example, cervical cancer. To be able to detect cancer generally at the early stage, we need to be able to have proper screening procedures. And we have different kinds for different kinds of cancer. For breast cancer, which I've mentioned, mammogram for the age of 40 and above. Now we're bringing the age down to 35. And then for any other person below 40 years can have breast ultrasound scan.
Now, I can see that we're displaying something here regarding the introduction. Cancer is a real global problem that needs global attention. We must work together to ensure that everyone receives the best care every time, irrespective of location, social, and also financial status. Tell us about this presentation here, please.
Okay, so we need to be able to... Okay, the presentation, actually, this shows the data that we have all over the world. As you can see, you look at the America, the Asia, they have different proportion of cancer when it comes to global burden of the cancer. Africa doesn't seem to have as much as possible, but the main thing you're going to see from, as we move to the next slide, is the fact that even though you're looking at the incidence talks about the new cases, and you look at the one in the Africa, to be precise, here, according to the screen. You can see that the one within the South Africa and West Africa, they are almost the same. But when you look at the mortality rate is quite high for West African region. It tells you that the Southern African region has been able to do something significant to reduce, the death rate or the mortality rate. And when you compare cancer globally, you can go to the next slide and then quickly. Then you look at the fact that people in developed part of the world, they seems to have more cancer detected in their hospital. However, the mortality rate is less than 50% compared to what we have in Nigeria, in Africa, where you see that the mortality rate is almost 50%.
Why is this?
Because number one, we have various factors such as the presence of comprehensive cancer center in Nigeria. If you look at comprehensive cancer center in Nigeria, the number is much less compared to what we have in developed world. Then you talk about the number of specialists. For example, the specialists that treat cancer in Nigeria, we don't have adequate number.
Yeah,
Look at
the jackpot.
And then even the field that we have in Nigeria, they are moving out. Yeah. So brain drain is, creating more gap. And also the fact that finance, a lot of people cannot afford out-of-pocket treatment system that we practice in the country. Health insurance, companies are not really helping. Nobody wants to take up the financial burden that is associated with cancer.
What role does religion and culture play in the lack of That word really just gets me in a bunch sometimes. Diagnosis test. So what role does culture and religion play? Because there's a certain kind of stigmatization, or the culture where Nigerians are like, what I don't know won't kill me, or Jesus is my insurance, that kind of thing. How much does it affect these cases of cancer when it comes to its mortality?
So it does affect it very well. For example, you have people who hold on to this myth that, okay, cancer is caused by this, is caused by that, or cancer is because of village people following them. So you see that a lot of people will rather hold on to the religious practices and the cultural practices and believe that they don't need to go to the hospital, so they can resolve it at home. And that alone leads to what we call late presentation to the hospital, advanced disease, and of course survival rate is less. It's about 20% and even.
Now, let's go back to your slide here. Let's look at the cases, incidence per 100,000 women per year. This is breast cancer, I'm assuming.
Yes, breast cancer in general. If you can look at this slide very well, you will see that talking about from 1960 upward, the number keeps increasing, as you can see. That is because a lot of people, much more, are now going to the hospital. Compared to what it used to be. People would rather stay in the house, die in the house. They will not go for screening.
So there were cases from before, but now people are reporting more.
People are now reporting more. Now we see early cases, much more than what we used to see before. So unlike what we used to see before this, everybody will present in stage 4, where the cancer is all over the body. But now you have people coming in stage 1, coming in stage 2, coming in stage 3. Stage 1 and stage 2 are called early stages, while stage 3 and stage 4 are called advanced stages. And the main thing is that even though people are coming in with a much earlier stage, but we still want more people to come in. So we want more people to be informed. We want more people to understand what cancer is. And we want more people to detect cancer even in their home, just by doing simple examination and by understanding what the age and whatever thing that is associated with them, can present in form of cancer in their body. With that understanding, they will know the right time to go to the hospital and to see the doctors.
Now, there's a whole list of cancer. This is World Cancer Month, but there's a whole list of cancer, from skin cancer to breast cancer to prostate cancer. There's so much. Here in Nigeria, which is the most prevalent?
Okay, so all around the world, breast cancer is the most common, all around the world globally. Then when you now come to places like Nigeria, then after breast cancer, we talk about cervical cancer. The two, for example, breast cancer is unique in the sense that it applies much more to women. So for example, we say every 8 women.
Can you define that, much more to women? So that means there's a small percentage that actually applies to men as well.
Exactly.
We're talking breast cancer now.
Yes, breast cancer. Men can also have breast cancer, but it is not common. So out of about 100%, we say about 1%, sometimes we say 2% applies to men, while the remaining 98% to 99% applies to women.
How does it manifest in men? Is it the same form, a lump?
Most of the time, the same form, lump in the breast. And the issue with men is because it is not common. When that happens, they don't see it in the light of the fact that they could have breast cancer and they don't go to the hospital early. So most men will present with late, in advanced stage.
Here in Nigeria, are there fears of wrong diagnosis? And could that also be a factor why people don't want to go? I don't want to be wrongly diagnosed and then go down this path of depression and all of that. Is there?
Yes, the chance or the probability that an individual could be wrongly diagnosed with breast cancer or any type of cancer is that the reason is that the number of specialists who are up to date in their knowledge, who have the skill, and who have been trained to be able to detect cancer early and make the diagnosis appropriately, the number is not much. So most people would rather see doctors, physicians, or even paramedics who are not, knowledgeable in terms of cancer detection, because many doctors know about so many things. But when it comes to oncology or cancer detection, diagnosis, and also treatment, many doctors don't know about it. And the ones that know about it, they are not all over. For example, let me just paint the picture of what we have in Nigeria, which is very unique and very peculiar. In all the states, we have the 36 states and of course the FCT that we have in Nigeria. We only have about 10 or 11 states that can boast of having oncologists. And then maybe about 8 that can boast of having what you call a standard cancer center. So what happens to the other people? They will have to see the physicians that they have. And those physicians will probably make the wrong diagnosis, tell them it's not cancer, tell them it's infection, take antibiotics, and they will continue to have that until the cancer will continue to grow. So we still have a lot of work to do in this country.
A lot of work indeed. In terms of support now, I know that states have come to support people who actually have this disease, or perhaps maybe push people to go for more diagnosis or go for more early detection. However, what more can people do as friends or family when it comes to supporting those who perhaps have been diagnosed with cancer, and also to encourage people to go for checkups?
Okay, so when people are diagnosed with cancer, they have a lot of needs, and beyond the financial, which is huge. You know, the family, the friends, even the group, the association that they belong to need to support them financially, because without money, it will be difficult to treat the cancer. And a lot of people will stay back at home because of money. So financial support is huge. And beyond that, there's also something that is emotional support. These individuals go through a lot of emotional, burden, and they need people to be around them to help them out and to let them know that, okay, they are not going through it alone. They are fighting, the battle together. So they need that emotional support, they need financial support, and of course they need other form of support like physical, being there. People are always there for them, telling them, trying to help them in the best way they can. They will definitely need support from friends and family.
Are there any encouraging new innovations in the world of cancer, early detection, or medicines that could actually help manage the situation? Are there new innovations? And while you're answering that, what place does herbal remedies play when it comes to cancer? How effective is it? Is there any science that is dedicated to that in Nigeria?
Okay, thank you very much. Talking about innovation, yes, there are innovative procedures or methods and even gadgets and diagnostic tools and even treatments that have been, released into the community of oncology. For example, when it comes to detecting cancer or to be able to stage cancer appropriately from the, to be able to say, okay, this cancer is in stage 1, you're sure of it?
Definitive.
Exactly. There is a diagnostic tool, we call it PET-CT scan. PET-CT scan is very accurate and more accurate than the conventional CT scan, the MRI, and the reason being that it combines two modalities together. So there is what we call the anatomical method or detection, which the conventional CT and MRI do, and then there is also the one we call the physiological function detection, which you have in form of PET. So you have PET combined with CT to give you PET-CT scan. And I'm glad to say that in Nigeria, we have such now, and we are the only country that have it in the entire West Africa.
That's fantastic.
And unlike before,
well, actually, that's
people used to travel out.
We need more of that across West Africa.
Yes, people used to travel out. Now, Mikio in Lagos has brought in PET-CT scan. And people travel from all over West Africa to have this PET-CT scan done. It's good for treatment, monitoring, and response, evaluation. Then when it comes to the herbal, what is the role of herbal? People have asked me this question, alternative medicine or to medicine, the care, that do they really help these supplements? Yeah. The truth of the matter is these combinations don't. I have seen a lot of patients that will come in and say, doctor, I don't want to take this chemotherapy, I don't want to take this immunotherapy, I don't want to do any of this. They will go out and try their natural means. They call it natural method. And then some of them will talk about diet control, don't take sugar, cancer feeds on sugar. Those things are scraps. They are not true.
Oh, wow, you shocked me there.
And then they go and practice this for about 6 months, 1 year, and then they come back. But this time around, they are coming back with advanced cancer, more cancer in the body.
Are you saying there's no place at all for natural remedies? Because I ask, the King Charles himself, actually is going through his own battle with cancer. And we were told from last year, was it early this year, about his intention to actually use the herbal remedies instead of going the orthodox way. So that kind of like emboldened people to think that there is something there. I find it hard to believe, as a botanist myself, that there are no remedies that could be provided from a botanical or from a herbal point of view.
Okay, so when you talk about, botany, there are medicinal content from some of those plants. And this medicinal content would have been tested You'll be able to know the doses. You'll be able to know the contraindication, what it should be combined with, what shouldn't be combined, when to be given. All of these things would have been done through scientific method. Then you can subject that to what we call clinical trials. Then when we'll have the outcome of clinical trials, we can apply it to human beings.
Doctor, that's why I'm asking. Because if we have this in Africa here, why aren't we dedicating research to try and helping us find these dosages, these interactions between whether a remedy, a herbal remedy, and maybe orthodox medicine? It doesn't seem like we are actually interested in that type of innovation. Is why I asked that question very, very definitively.
It's not only in Africa. There are developed countries that are also looking into that. And they have tested so many, and the ones they tested didn't seem to give us the kind of result we want. However, there are individuals who are still pushing it out, saying, oh, it's working, someone used it, and then it worked. And looking at the results, they can't push it into the global world for us to see. We need to be able to prove that what they claim to achieve is actually real.
Okay.
So we need to be able to see that. Otherwise, it's going to be difficult for anyone to believe. But the ones that have been used so far, we haven't seen any significant result coming out of it. And we cannot encourage people to go for that.
Okay.
Yes.
That's
and when it comes to innovation in medicine, in oncology, we have new drugs coming up. For example, we are talking about immunotherapy. For the first time, about early last year, for the first time, we found out that tumor that is advanced can actually be taken care of in a way. For example, the clinical trial that came out about advanced rectal cancer, there is a drug called dostarlimab, which is immunotherapy. It was given to those patients that have advanced tumor, and at the end of the day, we found out that the entire tumor disappeared. Even 6 months after, we haven't had recurrence. And a lot of people are now beginning to say, okay, it is possible to treat advanced cancer, and probably to say it is curable, unlike what we used to say. But at this point, we still say advanced cancer is not curable. It can only be managed with what we call the palliative treatment, as it were. But as we continue to, continue to do researches, then things are changing gradually. But until we get to that point, we will not be able to, to categorically say certain things. And then when it comes to herbal, orthodox, we may not be able to embrace, certain things that they are claiming to have.
Getting checked now, on a final note, how do we go about getting checked? Where do we go? What do we look out for when we're getting checked?
Okay, for categories, let me just quickly go through different types of cancer because they are not the same in terms of screening. For breast cancer, basically an individual that is below 40 years and is able to probably go to the hospital to have ultrasound scan. But before then, there are things that such women can do at home. So, for example, there's something we call breast self-examination. The woman, about a week after ovulation, goes in before the mirror, or lies down on the bed, or sit up, and then, lifts the end up. You can see that screen, the slide is there for the screening method. Then she's able to press the breast around and see if there is any abnormality. And if she's able to feel any form of lump, then she can go to the hospital to see doctor for what we call clinical examination of the breast. And then the doctor can recommend ultrasound scan or mammogram, as it were.
Are all lumps cancerous?
No, all lumps are not cancerous. That's why we need to take it a step at a time. Once a lump is detected, the first thing is go to the hospital, test will be done, and then there is a test we call fine needle aspiration cytology, biopsy, or for histology. We'll be able to detect if that lump has cancer in it or not. Okay. That's for the breast. Then for the other type of cancer, like cervical cancer, we have what we call the cytology, where people do pap smear or cytology, especially when they are below the age of 30, from age 21 and above, below the age of 30. Then once they are 31 and above, they can do what is called HPV DNA test, and so on and so forth. You'll be able to detect it when it is little. And then for other cancer like colon cancer, a man or a woman above 60 years can begin to have what we call colonoscopy.
How does it manifest colon cancer in itself?
Colon cancer in itself, you can see individual having constipation, diarrhea, or they are having blood in their stool. And then when they begin to have things like the abdominal pain, or they just notice that there is a swelling that they can, feel in their abdomen. So when they have things like that, they need to go to the hospital to have the test done.
Okay. Yes. What other common cancers should we also take note of?
Lung cancer is increasing now. lung cancer, liver cancer, they're increasing. And of course, among the men, the number one cancer is prostate cancer. So prostate cancer, the beautiful thing with prostate cancer is that it is not as aggressive as the other type of cancer.
In fact, it takes you a while before you even know you have it.
Before you know.
I heard that most people, most older men or old men who actually pass, may not pass from cancer, but it's discovered after, after what you call it, what's that word, post-mortem, that they actually did have it, but it wasn't what killed them. So it's a very common thing. We just don't know how common it is.
And that's what we say in the hospital. We say prostate cancer, people don't die of prostate cancer. They die, growing up with prostate cancer. That is the prostate cancer that is detected early enough and, appropriately treated or managed. So individuals that are above the age of 40, because it's common in the black men, above the age of 40 can have PSA checked maybe once every year, once every 2 years, once every 3 years. And from there, you will be able to know if there is any form of abnormality that needs to be followed up.
Any signs one might know, any signs that might just crop up?
Yes, so number one sign is the fact that the individual may begin to have issues with, urinary symptoms, we call it. We just find out, okay, this person, because there's not going to be any pain, this person is not able to urinate as he used to, or there's frequency, this person urinates more, or the person cannot hold the urine. Once the person feels the urge, the person wants to rush to the bathroom, things like that. So those are the common symptoms, but most men don't have these symptoms. There are other things that are associated with prostate itself as a gland, which may not be cancerous. For example, prostate can become enlarged, and still give the same symptoms as it would.
Where do you stand on the we've seen this on social media many times where doctors go up on radio stations and say that you should have more sex to be able to manage prostate. You don't have prostate. Is this true?
It is not true scientifically. People say that.
Say that again, doctor.
It is not true scientifically. It has not been, proven as it were. Like, there are things for us to speak as scientists, we must have facts. Facts from researches. And we would have seen that, okay, people that didn't do this, they had this outcome. People that did it had different outcome. Then we'll be able to prove that.
So you're saying like categorically that frequent sex does not save you, does not keep you, safe from having prostate cancer, nor does digital manipulation of your organ, just so you know, and you heard that here. Because the doctor said that. I didn't. I'm not a doctor. He is. So thanks for making that clear, doctor. And also thank you for being with us on the show here today. It's been a very interesting session here with you regarding how we can actually detect very early cancers and the different kinds, and how this could save our lives. Going early detection is actually very, very good for you, whether male or female, and spread across all the different kinds of cancers. Thank you very much, Dr. Adeniji.
Thank you for
joining
me.
us. We're